guys, how are you doing? I hope you had a great week. I am doing okay and coming to you on a topic that's common. I guess it's generalized, but it's common when people talk about mental health. Mental health is an umbrella, if you ask me, of both physical, psychological, and social well-being of an overall person's health. That's what we, let me push this a little bit towards me. That's what we talk about when we say mental health. So it's your overall health in combination of everything that makes you function at your optimal level, if so to speak. It affects how you think, it affects how you work, it affects how you relate with others. So it's important for all of us to be in a good mental health state. Is our mental health affected sometimes? Yes, it is. When sometimes the resources exceed what we can offer, that can affect our mental health. But in general, if we can keep it balanced, both psychosocial, psychological, and emotional, then we are at a good balanced state. It affects everybody from every stage in life. Children will handle it differently. Adolescents will handle it differently. Adults and geriatrics will handle it differently. But it does affect everybody at any stage of life. Sometimes when the stress is too much, then it causes your mental health to be off balance, if I should say. Why is mental health important? It is a combination of everything to make us live at our optimal best. So we need to be balanced psychologically, we need to be balanced emotionally and socially to be steady and balancing at a very good point in our lives. Sometimes are those things off balance? Yes, sometimes they can be off balance, but if all those components of health work well together, then we're at a good mental health state. But if they are off balance, then our mental health state is not good. It will cause us to have other diseases, heart disease, diabetes, all those put together. Especially chronic conditions, they increase the risk of mental health. So chronic conditions, you may ask, what are chronic conditions? Things like diabetes, asthma, chronic obstructive pulmonary disease. Those long-term diseases can increase our risk of mental health. And in what sense would they do that? If you're in this disease process and it's not getting better, cancer. Oh, how did I forget the big cancer? Cancer is also one of them. If you're in that state of mind and all the time you think about it, sometimes it makes your mental health, not sometimes actually, all the time it will make your mental health not balanced because you've been sick. It is not a disease that comes and goes, which is like an acute disease, which is, less than 3 weeks and it goes away. This is a long-term chronic disease like diabetes, which you have to deal with from when you were diagnosed up to the end of your life, or COPD exacerbation, where you have to carry oxygen with you everywhere you go. So these are long-term diseases that affect you. Cancer, if you're diagnosed early with cancer, it can be cured. Usually stage 1 or 2, it can be cured. I've seen some stage 3s and 4s be cured. But if you're diagnosed with cancer, it is also emotionally exhausting on your mental health. So a lot of the long-term diseases, and I'm just naming a few, but those are the main ones that come up quickly to my head, will cause you mental health to be off balance for sure. How common is it? How common is mental illnesses? It's pretty common. 1 in 5 people will have a mental illness. It happens, as I said, in every stage. Not so much babies, but babies have a different stress reaction, because like little babies, if they're stressed or something has happened to them, their way of showing it is crying. That's the best way they know how at their age. Youth, anywhere from 13 to 18, at some point during their life, can have a mental illness. Adults, it's common. 1 in 25 at some point in their life will have such a serious mental illness, such as schizophrenia, bipolar, major depression. That can happen to anybody. You can be as healthy as be, and then life happens to you and you get into depression. So either one of us can get into mental illness at any point in our life. It affects everybody, just different categories. Kids don't experience it as much. Youth, 1 in 15, adults, 1 in 25, and sometimes geriatrics also experience it actually. It is across the lifespan, so any kind of person can experience it. What causes mental illness? Trauma, feelings of loneliness, isolation, long-term chronic diseases that you've been diagnosed with, such as cancer, use of alcohol and drugs, experiences related to chronic medical conditions, especially diabetes, cancer, COPD exacerbation. You have to carry this oxygen everywhere you go, and you have to be on oxygen all through. They go through periods where they're very steady, they get sick, and the oxygen needs go up, their breathing is hard. It is so tough. So it can happen to any of us. Adverse childhood experiences, which in another word I'd say trauma. If a child has had like a history of abuse, sexual assault, being raped, stuff like that can cause mental illness to most people. Chemical imbalances in the brain will cause mental illness to some people. So it is good to take care of ourselves. It is better if we are balanced, both psychological, social, and emotional. Sometimes at any point in life, you're off balance. Work through it, but it would be nice if everybody would be balanced emotionally. But it's a seesaw. Sometimes you're balanced, sometimes life happens and these things affect you, but it's important that we take care of our mental health so that we experience life at its best or most optimal level. And that's when everything is in sync for us, and not having the diseases, not having the mental illness. That is the perfect place that we can be. But if at all we do get into a mental illness of some sort, depression, it is okay to seek care. You do have counselors, you do have doctors, you have people you can talk to. Make sure you talk to people so that the burden is not just on you, because it can get heavy. So it's important to share with whoever it is that's important to you. Is it a sibling? Is it a friend? Is it your doctor? Is it a therapist? Whoever you feel comfortable sharing with, we can share with these people and make it a little lighter. You guys have a wonderful evening, and we'll catch you in the next video. Bye-bye.